My name is Dr. Sylvia. I'm a general practitioner. I'm also the founder of AskAwayHealth. Welcome back. Thanks for joining me this morning. We're going to go straight into today's topic, which of course, as usual, is a question that someone has sent in. I would just love to use this opportunity to say thanks to new subscribers and returning subscribers over the last month. Really, we've seen such a big growth in the channel. Thank you so much. You're the ones who make this worthwhile. You make it happen. The engagement is fantastic, so thank you so much. Don't forget to leave a like and subscribe to the channel. Today's topic is, let's just put that on. So this is today's topic, and it's about the Depo shot. I thought it was a really lovely comment. This is just the way it was presented to me. Just after 10 years of being on the Depo, I'm literally scared to come off it. That was exactly as it was sent in. And I didn't really get the chance to be able to clarify what's making you scared, why you worried about coming off the Depo, and questions around, you've been on the Depo for 10 years, what's been your experience? So many things to look into with that little statement, but this is the opportunity. This is the opportunity for us to now go into detail. And if you're there, or if you're here and you've been using the Depo for this long or longer, or are thinking of using the Depo as long as you'd like, but you've got questions, or you've not even started using the Depo and you just want to understand how it works, please let me know in the comments. Please share this with anyone who you think is having issues with the Depo, wants to ask questions. Let us go through this and try and work out, get an answer to this question. So a little bit of background. I would usually like to give you a bit of background, but please remember that I do have a couple of videos on the Depo shot, looking at how it works, looking at long-term side effects, really distressing side effects, and so on. So please check those out. Again, I will place the link in the description. But just by way of background, when we say the Depo shot, we're talking about the birth control method, which is known as which contains progesterone, the hormone progesterone, and is usually given as an injection. That can be an intramuscular injection, so your nurse or caregiver or doctor might talk about IM injection, which is given directly into the muscle, okay? Or it might be a subcutaneous, so they might say subcut or SC injection. And those are usually the preparations that are marketed or sold as being self-administered, so you can give those yourself and they go into the skin rather than into the muscle. So you've got different types of Depo progesterone injection. So I'm just going to call it Depo shot so we don't get mixed up. But there are different types, different doses, given in different ways. So to be sure the type that you have, there may be small differences here and there, but generally what they have in common is they contain the hormone progesterone. So this birth control method suppresses ovulation or inhibits ovulation. Ovulation, of course, is the release of a mature egg from the ovary. And generally what this means is that the available amount of estrogen while you're on the Depo is reduced. But then this is the way it provides contraception by inhibiting ovulation. Let's look now at possible reasons why somebody might say she is scared to stop using this method. So let's think about it. She's been on Depo for 10 years. Now, if you're taking the Depo shot injection, usually the injection, the intramuscular injection that's given to you by a nurse or by your doctor, usually is given every 12 to 13 weeks. So just picture this, that somebody has been getting this injection every 12 to 13 weeks for 10 years. And they've gotten to the point now and they're thinking about or considering, or the idea has come up, but they're scared to come off it. Why? What are the reasons? So I thought it was interesting to look at the possible things that could be going through their minds. And the first one I thought about was the fear of stopping the injection and the delay in return of fertility, delay in the ability to get pregnant, the delay in the return of the periods. This is a common concern, and whether you take the Depo for 1 year or 18 months, or whether you take it for 5 years or 10 years, and you're still interested in having a family, you could still get support within that characteristic of the Depo, that it can take up to 12 months for a return of normal periods and therefore return of fertility. So I've said to us on videos before, and I say to my patients as well, that if you're on the Depo shot, what you need to be thinking about is medium term, long term, what exactly is the plan? Because if you're thinking you want to be on it for 6 months, half a year, or for a year, and then you're thinking of starting a family, then you need to be saying to yourself, how soon do I need to come off this method? Because I want to start having a child. It's different from taking the pill, the mini pill, which also contains progesterone, but the amount of progesterone in both drugs is widely different. The difference is that with the mini pill, you stop taking it within the next month or couple of months, your fertility has returned, your periods are back on, and then you're looking at getting pregnant. With the Depo shot, you might have that delay. So this is one thing that could make a woman feel really uncomfortable about coming off it. She wants to do it, she needs to do it, but she's worried. And how can you improve your fertility? What can you do? Like I said, the first thing is to have a plan. Be aware that when you come off the Depo, it could take some time for fertility to return. So you can't stop it today and expect, right, I'm going to get pregnant in 2 or 3 months. If that happens, fine. If it doesn't happen, we're not going to panic. It could be because as a result of the Depo, and some women could experience that up to 6 months or longer. They say up to 12 months. So factor that into your planning. I would say if you're thinking about how to improve your fertility, get the plan right, get your timing right. But outside of timing, what else can you do? Please don't stress about it. Because the worry, the concern, that mindset, what's happening to my periods, going from one place to another, trying to get one test or the other because you're thinking there's something wrong, can also affect the return of your periods, just that state of being stressed about the whole thing. So it's also important to be aware of what's going on in your body. Consider that this is potentially a side effect of the drug, and stay calm, avoid anxiety and panic about why am I not getting pregnant, especially if you've recently come off the Depo. The next thing I'll say, number 3, exercise. So a healthy mindset, healthy mind and body. We just talked about avoiding stress, but also your body. So some form of exercise, swimming, yoga, aerobics, whatever it is, going to the gym, lifting weights, whatever it is that you're into, taking walks, whichever it is that you're into, that you can commit to over a period of time. The benefits are countless. Today's video is not about the health benefits of exercise, but of course we know that would help to keep your weight down. That will improve your heart activity, which you definitely need as you get into pregnancy, and of course keep your muscles supple. So many things involved in terms of getting your fertility, helping to get your fertility back after stopping the Depo. That, of course, is related to eating in moderation. So I'm not a huge fan of a particular diet type or the other. I believe in moderation in whatever you're eating, but just being very conscious that what you want to do is cut down on high saturated fatty foods, takeouts and processed foods, high salt diet, very, very minimal amounts of alcohol, sugary drinks and so on. Being fully conscious that these things could make your blood cells, make your muscles less healthy. And what you want to do is put your body at an optimum state for getting pregnant. So it's really important to be thinking about those key things: your exercise, your diet, avoiding stress, and planning. These are some of the things. Supplements, fine. If you're already guys, that you and your partner are being sexually active, you're having sexual intercourse, you should be on folic acid supplements, because you don't know when it's going to happen. And what you want to do is provide all the nourishment and all the protection that your baby needs if you get pregnant. So already having that mindset of behaving like somebody who is about to fall pregnant, especially when you've been off the Depo shot for a number of months. So that was one point that I thought, could somebody be worried about coming off the Depo for this reason? So going back to the second point, if you've been using the Depo, one of the things that you would experience is you stop having regular periods. So some women actually have very little blood loss with a scanty blood flow while on their Depo, but a good number of ladies will actually have no periods while on the Depo. Now, some people are worried about, they're not really happy about, but for some people it is the bomb. Some people are happy with that kind of situation. So a concern might be that she's going to lose that freedom from having to wear sanitary towels, from having to use panty liners, from having to use tampons, wear menstrual cups, and even buy them. The money going to be spent on buying them, she might be thinking, oh no, my periods might come back and then I'm going to have to get into all that. Because 10 years, goodness, imagine 10 years without periods. So that might be another thing, that she's scared of losing that freedom of no periods that she's had. And don't forget, many ladies usually get on the Depo shot for birth control, but don't forget that it can also be used to treat bleeding problems, heavy menstrual bleeding, particularly in the UK it's licensed particularly to treat endometriosis, which if you're familiar with my videos, can cause heavy pain for periods. Please go and have a look at my endometriosis playlist to learn about this condition. But the Depo shot is one of those treatment options that women can use, and because it nullifies, if you like, the periods, women can be absolutely free of that pain and that heavy blood flow, and they might actually experience no period. So imagine somebody who's been on the Depo shot for that purpose and then is about to come off it and potentially facing a return to that troublesome type of bleeding. That's one possibility. That's one reason why she may be concerned, okay, because of the loss of the amenorrhea or the lack of bleeding that happens when you use the Depo. Now, the third point I came up with is weight change, weight gain in particular. Let's call it what it is, weight gain. That's what many women have heard about and that women are worried about when it comes to the Depo, that taking the injection can make you gain weight. And I think this also, it depends on your experience, to be honest with you. Some women might be concerned that when they come off the Depo, they might actually gain weight because there's some after effects, and I have done a video on this. What are the effects that you might experience after stopping the Depo? Some women might be concerned about actually gaining weight. Again, all this has to do with the regulation of hormones. Don't forget that the Depo, you're getting every 12 or 13 weeks or 8 or 10 weeks, depending on the particular brand you're taking. You're getting these shots of hormone into your system, which are shutting off your natural hormones. So when you stop taking them, there's going to be a return of your natural hormones. But initially, they're just sort of firing from all engines. It's a bit chaotic when things are trying to get back to normal. So it may take a while, and that's why the issues with weight gain, the issues with delayed return of the periods, all that is because of the natural hormones haven't yet started flowing. They're not coming out, or they're not being produced. They should be coming. The hormones should be produced at a level or at a pace that is consistent or that goes with the way your body functions. So it's not chaotic, but it's either it's up in the morning and then it goes down over the evening, up in the morning and then goes down in the evening. There's a pattern. Initially, when you first stop the Depo, the pattern is absolutely non-existent. So that's what I'm trying to explain, that the pattern takes a while to return, and that pattern, when it comes back in, then these problems with all these after effects from using the Depo, acne, headaches, other skin problems, weight problems, bleeding problems, fertility, all that will calm down. So my thinking is has she had an issue with weight while on this method? And conversely, I know it's really hard to believe, but some women have also talked about weight loss, not as often as weight gain. But so what I'm trying to look at is concern about changes. Just like somebody was on the Depo, she didn't have periods, fantastic, and now she's thinking, if I stop the Depo, are they going to come back and they're going to be really bad when they come back? Somebody may have had issues with weight and then got on the Depo, things seem to stabilize, and then she's worried about coming off it. It's not very common, but again, we're discussing this possibility, what was going on. I've talked about the Depo side effects. Again, I've got a video on the channel around that topic, but they may be unexpected. So these are symptoms that you don't expect. Poor sleep, bloating, there are quite a few of them. And I really think if you're on the Depo, honestly, if you're on the Depo, regardless of how great it is for you as a method, have a look at that video. Have a look and just be familiar with some of the issues. They're not horrendously, certainly not life-threatening, but they're sort of maybe some distressing, a bit of a nuisance kind of thing that might happen for a couple of weeks, a couple of months after you stop taking it, because your body's natural hormones, like I've just tried to explain, take some time to get back to their regular pattern. Okay, next, the loss of benefits. Did you know that when you're on the Depo shop, there are a few benefits that you might actually get? You know, most of the time the press is all about the negative effect. Oh, it takes a long time for your fertility to come back. Oh, this happens. And don't get me wrong, please. I'm an advocate of, if as a woman you're having trouble with your contraceptive method, please don't sit and cry about it. Come and talk to us, okay? Some women can have really horrid experiences on some of these methods, while some women, you know, they're having a ball. But I would really say we tend to talk a lot more about the, you know, the sort of complications and the risks, and sometimes don't give too much attention to the benefits. Taking the Depo can have some benefits. We've talked about women who love the fact that they're not having periods, they're not having to buy towels and tampons and so on. One of the benefits of the Depo is that it's not associated with an increased risk of ovarian or womb cancer. And in fact, some studies suggest it may protect. So just being conscious of that, just being aware. And somebody who's on this method may think, wow, what if I lose this protection? So that's a valid reason to be scared to come off it. And I'd understand that, and we'd be looking at what alternatives can you use, what else can you do to protect yourself and reduce the risk of that happening. Okay, so I think that's about 5 benefits I've come up with, and I've got an extra one that looks at its benefits in a group of ladies that we don't often talk about, but this is ladies with sickle cell disease, for whom some of the other methods can be an issue, particularly things like combined hormonal birth control methods containing estrogen and progesterone, where there may be an increased risk of developing blood clots. Because with sickle cell anemia, especially if somebody is particularly prone to experiencing lots of sickling and lots of crises, they may already be at that risk of developing clots within their blood vessels, and then you then add a method that can increase the risk of that happening. That's not good. So the Depo is a solution for this, you know, group of ladies, because that risk of blood clots forming in the blood vessels is less, not actually associated with the Depo injection. So could this person be in that category? Could she be that one person or lady who has been using the Depo for 10 years because she has sickle cell anemia and it's been fantastic, but for some reason she wants to come off it? Maybe she wants to have a baby, or, you know, whatever, and she's literally scared as a result of that. Now, obviously, if she's doing that because she wants to start her family, then what we're looking at is other measures to protect her in terms of preventing sickling crises, preventing bone pain, preventing all the other issues that could happen, avoiding things like dehydration, avoiding things like infection. Again, on the channel, we have a great sickle cell disease playlist, where it's good to have a look at the treatments and the cures I talk about for people who have sickle cell anemia, whether they are SS or AS, SC. I do talk about that, the things that you can do to improve health generally. So guys, these are my thoughts in terms of this particular question. If I had this lady in front of me, I would go through these sort of 5 or 6 points. And then, of course, find out from her what exactly is she concerned about. But I really thought it was interesting to just tease that question. And if you have any thoughts, or if it was you who sent in this question and you come across this video, please drop a line in the comments. Let me know what else you could be scared about.